A lot of patients are wondering, what are we doing when we are measuring the gums and telling some figures, 3, 2, 3, 4, 3, 2,
Good
or
question,
something.
yeah.
And those are the gum pockets we are measuring. It's the depth of the pocket. It's a pouch-like structure formed between the gum and the tooth. Healthy limits are between 1 to 3 millimeters. If it gets any deeper than 4 or 5 millimeters, then creates an environment that's good for bacteria to accumulate and create a gum disease.
Okay.
For those patients, we have many treatments available to reduce those pockets. There is also laser gum surgery available. There are recontouring of the gums are available, and also scaling and root planning available for those patients to get rid of those pockets. The pockets are the main reason for the gum disease. Gum recession is an issue that happens a lot, is very common, and there are a lot of things we can do to restore those gums to a natural state. Because of the gum recession, the root surface gets exposed and it becomes sensitive to cold, hot, or a touch. And since it's not protected with enamel, the root surface gets susceptible to decay too.
Okay.
And it also creates oral hygiene issues and also cosmetic issues.
It doesn't look good.
It doesn't look good. What we can do now since we have tissue banks available, we can get those tissues from tissue banks and do gum plastic surgeries to restore those gums to cover the root surfaces. And the procedure became so simple to perform now, and it's so easy for the patient. There is no post-procedural pain or any discomfort involved. IV sedation. Lots of questions about IV sedation. Don't let the fear of going to a dentist keep you away from having wonderful smile. Today's dentists are utilized. I'm trained in administering IV conscious sedation to a patient, and that's a wonderful service for dental phobic patients. IV sedation is extremely safe, and the safety is my #1 priority. It stabilizes patients' blood pressure and heart rate. They feel much relaxed. The fear goes away, and depending on the level of the sedation, most of the time they are asleep during the procedure and they don't even remember what was done.
Now you say you have two types of patients, the highly anxious, and then of course the busy people that want a bunch of
Yes.
procedures done in one day. Tell me about that.
IV sedation is not only good for highly anxious patient, but it's also perfect for patients who have very busy schedule and they want to have most of their dental treatment done in one visit, start to finish.